There are some other side effects of just testosterone in general that people may experience. So some people report having worsened acne when they start testosterone. They may have some abnormal lab test results, which is why we repeat labs often. That's to make sure none of these abnormal labs show up. You can have some changes in urinary symptoms. You can have a change of mood. Some people report a loss of hair or alopecia. You can have change in blood pressure, and it can also cause you to have a low sperm count. Some more uncommon side effects are any disorders of the testicles, an enlarged prostate may happen, and sometimes sleep disturbances can occur. However, testosterone for the most part is quite safe to use. Many people use it in their daily lives. It's just important to make sure you take your dose as prescribed, because doses that are higher than what you are prescribed can cause an extreme elevation in testosterone and can increase your risk of getting these side effects. So make sure to always double check your dose, the amount of ml that you need to inject, or the amount of milliliters you need to inject, to make sure you don't inject too much. Typically, as I said, it's going to be about 0.5 milliliter to 1 milliliter, depending on the concentration and the strength of your dose, and it can be injected once or twice a week, depending on how the provider writes the prescription for you. These medications can all be stored at room temperature. You should try to refrain from storing it somewhere that's humid or wet, like a bathroom, because that can increase the deterioration of like the rubber stopper, but they are in glass vials, so nothing should penetrate the glass. You should also tend to keep these either in the box that they come in, or in a dark cupboard, just because you don't want the medication exposed to light, which can sometimes alter how a medication works. Again, these can be stored at room temperature, and once you start using one of them, so once you pierce the rubber stopper, that starts the timer of how long the medication is good for. Once you pierce the rubber stopper, the medication is good for 28 days. So essentially, you can only get 4 doses if you're using this once a week, or 2 if you're using it every 2 weeks. And then after that, any additional medication you have in the vial should be disposed of. You can put it in your sharps bin with the rest of your medication. That's totally fine, and should not be used, just because the stability and the potency of the medication is not tested beyond that 1 month. So you may not get the same or correct dose if you continue to use the same vial. This medication can be taken continuously for the rest of your life to maintain your levels of testosterone. Most people take it continuously, especially as they age, because it can help reduce some of those signs and symptoms of low testosterone and aging. Thank you for watching this video. If you have any further questions about using the medication, don't hesitate to reach out to the medical team via your medical inbox, or to the pharmacy at pharmacy@jackhealth.ca. Any other questions that you may have about the medication will be on the how-to page. So we go through in detail in writing how to use these medications as well. And of course, using this video to help demonstrate how to inject the medication. Again, if you have any questions, let us know. Thanks for watching, and I hope this medication works well for you.